Hi, welcome to the Student Support Framework Diagnostic Tool, Identifying Root Causes and Creating SMART Goals training. As a part of the Stronger Connections Grant, TIMH, or the Texas Institute for Excellence in Mental Health, is providing this opportunity to learn more about ways to analyze root causes and to develop SMART goals. In today's training, we will take a closer look at what a root cause analysis is and two strategies, the 5 whys and the fishbone analysis strategy, while walking through a scenario. We will then learn more about SMART goals and create a SMART goal. The purpose of this training is to equip the Stronger Connections grantees with an additional training resource to refer to when creating or refining SMART goals for their campuses upon completing of the SCG diagnostic rubric this fall of 2025. Let's take a minute to look at the big picture and set the stage. You have completed level setting training on the Student Support Framework, or SSF diagnostic, conducted your school climate assessment, and are currently working through the 2025 school climate assessment, and completed either the SSF diagnostic or the SSF readiness check last spring. Today, we're going to take a closer look at what a root cause analysis is and how root causes are related to the development of SMART goals. This work will set the stage for your team to clarify your priorities and decide on or clarify the strategies within your change plan and get to the important work of student support system building. As you may recall from the initial diagnostic rubric training, which was in the beginning of the spring 2025, identifying root causes by using a root cause analysis tool is a great problem-solving method used to identify the underlying reasons why a gap may exist. It focuses on finding potential issues below the surface rather than just addressing its symptoms, aiming to prevent future occurrences. This systematic process uses various tools and techniques to investigate more about why a gap may exist and also determine the gap's origin. Once the origins of a potential gap can be identified, it can make creating SMART goals easier and more focused. We're going to discuss SMART goals later in this training. As a part of the SSF readiness check and/or diagnostic rubric completed last spring, it's likely that you and your team were able to identify an area or areas that you would like to focus, your priority. In this initial diagnostic step, you may not quite be ready to set goals. Before setting a goal, it's important to deeply understand the reason that this issue may be a gap within your school community. It probably isn't just because no one thought of it before. It could be helpful to walk through a root cause exercise as a team to try to move beyond what may be easier to recognize to discover the true underlying challenges. The root cause is the core issue, the issue that sets in motion other cause and effect chains and results in the problem. For the purpose of this training, we're going to share two strategies for identifying the root causes of issues, the 5 whys and the fishbone analysis. We have provided blank templates of each of these for you to use with your teams. Let's first take a look at the steps for identifying root causes. This thorough 5-step process ties the steps directly to the diagnostic process and collaborative teamwork, and reinforcing the training's context and the importance of data-driven decision-making. Step 1, clearly define the problem or gap to address. You can do this by asking, what is the main problem that we need to solve when working through the root cause analysis and towards SMART goal writing? Identify and document that priority problem area from your diagnostic rubric results. Step 2, identifying contributing factors. You can do this by using a root cause analysis tool. like the 5 whys or the fishbone, to identify the contributing factors. A team might ask themselves, what factors contribute to this problem? During this step, the team collaboratively works to analyze contributing factors using team discussion and root cause tools. Step 3, group the causes together. Teams will look closely at the potential root causes to organize and categorize to clarify patterns. A team might ask themselves, how can we group these causes to see common themes? The purpose of group and synthesize the potential root causes together is to inform team understandings. Step 4, select priorities. Prioritize root causes that are actionable and relevant to your goal. A team might ask themselves, which causes should we address first to have the greatest impact? The purpose is for the team to select priority causes based on data and team consensus. And step 5, develop strategies to address the problem. For the purpose of this process, the team is to create targeted strategies that are specific, measurable, achievable, relevant, and time-bound, also known as SMART goals. A team might ask themselves, what strategies can we develop that align with SMART criteria? The purpose of this step is for the team to develop strategies and draft SMART goals to address selected root causes. Now what we'll do is take a look at an example scenario. After working through the diagnostic rubric, we find that our campus does not currently have an efficient MTSS team. Step 1, identify the problem. The problem is our campus does not have an efficient MTSS team. Step 2, identify contributing factors. Contributing factors might include lack of knowledge of what MTSS is, lack of team planning time, other meetings that currently support students, or an overwhelming number of other kinds of meetings. Step 3, group the causes together. When we group the causes together, we see that there is not a clear understanding of MTSS for campus leadership or new teachers. And we have other student support meetings that may be doing the same work that are just named something different. Step 4, select the priorities. Education and mapping. We discover that we need to educate our campus on what MTSS is and what MTSS isn't. And we need to map our current meetings to see if there is an overlap and efficiency happening. For the purpose of this example, step 5, develop strategies. We will work with our ESC lead to be trained on MTSS. We will brainstorm purpose and intent of all of the student support team meetings that we currently have and look for overlap and work with our ESC lead to help us potentially combine and coordinate. So this was a simple example of how you might look at some findings from your diagnostic using the root cause analysis. The 5 whys is a problem-solving technique used to explore the cause and effect relationships underlying a particular problem. By repeatedly asking why 5 times or more if needed, this technique helps to move beyond superficial symptoms and identify the root cause of the issue. Each time why is asked, the team is able to delve deeper into the underlying causes of concern. This allows for more effective solutions to be developed and implemented. So let's take a look at how to use the 5 whys with this scenario. The 5 whys takes place during step 2 from the previous slide of identifying contributing factors. Let's consider the following example to use for this 5 whys strategy. The problem is our referral pathway isn't getting many referrals. Our referral pathway isn't achieving the success that they want in connecting students to services. The 5 why strategy would ask why there might be gaps with the referral pathway to look deeper into this issue. When looking at their data, the school team may notice that families or caregivers are not making referrals for their students. Number 2, why? If they stop there, they may think that just communicating the referral process more broadly would fix the problem. But if they continue to explore a little deeper, they may find that many families don't believe children have mental health concerns or that seeking treatment for mental health is okay. There may be misconceptions that are blocking them from reaching out and seeking support. The team may create a different solution to resolve that root cause. Another school with the same problem may find a different root cause, such as families not liking the service options available to them. If teams stop too early in determining the root cause, they may put effort into the wrong solution. It's also important to note that as teams are working through root cause analyses, they might find that they're missing valuable data to truly dig into reasons why. This is an important time for teams to pause and seek more data or information to move forward. Let's take a look at another tool used for root cause analysis. This tool is called the fishbone analysis strategy. The fishbone analysis strategy also takes place during step 2 of the root cause analysis of identifying contributing factors. A fishbone diagram, also known as a cause and effect diagram, is a visual tool used to systematically identify and explore the root causes of a specific problem or effect. This strategy gets its name because it resembles the skeleton of a fish. The head represents the problem or the effect. The bones branching off the spine represent major categories or potential causes. The smaller branches represent more specific factors within each category. For the purpose of this fishbone analysis, we have chosen the following factors to consider: collaboration, communication, people, including students and staff, resource, environmental, and policy and procedure factors. Each of these chosen factors are important factors that can contribute to the success of school mental health systems. Oftentimes in schools, there are factors that get in the way of successful implementation. Collaboration, meaning external and internal partners oftentimes are not collaborating. Communication. These communication factors can be on an individual, campus, department, or system level. Resources. Resources can oftentimes include fiscal resources, time and effort, or even external or internal resources within the system. Environmental factors. These factors can include the physical environment, facilities, equipment, classroom or campus environment, or even the larger school community system. Policy and procedure factors could include gaps for policies and procedures in the school system that address school mental health, academic success, and support staff. Looking at the previous example of the problem, our referral pathway isn't getting many referrals. The bones branching out represent major categories of potential causes. Let's briefly take a look at these factors just described. Looking at this fishbone analysis, we can see that potentially one of the collaboration factors is that there are no memorandums of understanding in place. Potential communication factors could be many leadership changes with new leaders that have not been introduced to outside providers, or staff that have not been trained on the referral process. People factors, including staff and students, could include staff are unaware of the referral pathway process and students and families are not referring. Resource factors could include there's not an awareness of community resources to support outside referrals, and no staff are available to support the work of this important project. Environmental factors could include a lack of space for outside mental health support to office on campus, and there exists mental health stigma in the school community at large. Potential policy and procedure factors could include, again, there are no MOUs in place, no process in place for students to self-refer, for families to refer, or for staff to refer, and this has not been a part of the campus or district improvement plan. As you can see from this fishbone analysis strategy, this strategy takes a different look at potential root causes than the 5 whys strategy just shared. So let's take a closer look at a specific case study. This is a rural LEA case study, and we'll use this case study to walk through the entire process of root cause analysis and SMART goal setting. A small district in Central Texas with approximately 1,000 students pre-K 12 has recently received grant funding to begin supporting the overall mental health and well-being of students and staff. A Tier 1 character education curriculum developed by a retired longtime educator within the community is used sporadically in about half of the grades pre-K 12. On occasion, the School Health Advisory Committee, or SHAC, meets to discuss what is happening within the school district without any formal process, topic, or agenda. The professional school counselor instituted assemblies to teach 8th grade students and their families about suicide prevention, fentanyl use, and drug poisoning. Over the past summer, communication with the local mental health authority has been initiated about the potential to bring school-based services into the district. There are many community members who have expressed concerns about this partnership. When mental health screening plans have been discussed at school board meetings, there is also a great deal of concern and distrust with the screening and referral process. During the back-to-school professional development days, a full day was spent with all district staff discussing mental health, signs and symptoms, trauma and grief-informed practices, and suicide prevention. And there are now plans for the professional school counselors at both the elementary and secondary levels to talk about educator wellness and share strategies for managing stress. At the back-to-school parent meeting, the mental health referral pathway is shared with family members and caregivers of students. At this time, there are no Tier 3 interventions available for students. While there are structured meetings in place to talk about concerns with students, there is not a formal process or structured written plan created at the conclusion of the meeting for each student or concern. As you can see, there's a lot going on in this case study. We can see that there are many areas that we might need to take a closer look at root causes and develop SMART goals for. For the purpose of this training, we're going to take a closer look at just one of these areas. Now let's look at the identifying the roots strategy for the LEA case study just shared. With that specific scenario, there are many areas that could be addressed. So let's choose just one piece of the scenario and see if we can identify the root causes. Over the past summer, communication with the local mental health authority has been initiated about the potential to bring school-based services into the district. There are many community members who have expressed concerns with this partnership. Let's walk through these steps together. Step 1, identify the problem. What is the problem identified? The problem is there are currently not school-based services in the school district, and there are community members expressing concerns. Step 2, identify contributing factors. What are the contributing factors? We could go deeper into this potential contributing factors by using the 5 whys or the fishbone analysis strategy on the next slides. A conversation and a relationship has not started about the need for these services. Addressing mental health needs in school has not been a priority. Our district has historically only focused on academics, and there has not been a discussion of mental health. Mental health stigma exists in our community, or there's not a true understanding of what mental health is and how mental health can affect students. So as you can see, lots of contributing factors we'll take a closer look at in just a moment. Step 3, group the causes together. What could be causing this? What are some causes that the school can address and take care of? Things that might be causing this could include past experiences with the local mental health authority, cultural implications of what mental health is and what support could look like. Ways that the school could address this could be to begin relationship building with the local mental health authority publicly in school and community hosted events, begin educating the community on mental health and mental health services and supports. Step 4, select priorities. What are the priorities of this situation? The priorities of this situation are to move forward and create a partnership with the school and the local mental health authority. And step 5, develop strategies. What strategies do we need to put in place to address this? Strategies that could be put in place to address this is to ensure local mental health authority leadership is involved in the shack. School mental health planning processes and calendaring times for the school and community to come together to learn about mental health, etc. Let's take a closer look. Let's use the 5 why strategy to look at other potential root causes of this area of concern for one piece from this scenario. The problem is, again, there are currently no school-based mental health services in the school district, and there are community members expressing concerns about a partnership with an external agency. Remember, the 5 why strategy continues to ask why to get below the surface to see what's really going on. Why? A conversation has not started about the need for mental health services. Why? Addressing mental health needs in school has not been a priority. Why? Our district has historically focused only on academics, and there has not been a discussion about mental health. Why? Mental health stigma exists in our community. And why? There is not a true understanding of what mental health is and how mental health can affect students. As mentioned earlier in this training, you can continue to ask why beyond 5 times if that's helpful for your team. Now, let's take a look using the fishbone analysis strategy of this same scenario. Again, the head of the fish provides the problem. The problem is there are no school-based mental health services and community concern. The fishbones provide the main cause categories and contributing factors. So let's look at these. Some potential collaboration factors include limited partnerships with the local mental health providers, lack of joint planning with community stakeholders, school and community goals are not aligned, previous attempts at collaboration were not sustained, or even difficult past relationships with outside mental health providers. Some potential communication factors: lack of transparent updates to families and communities. The district hasn't been communicating. Misunderstandings about the purpose of school-based services. Inconsistent messaging across campuses. And even no clear spokesperson or liaison in the district. Looking closely at people, student and staff factors, potentially staff feel unprepared to handle mental health concerns or mental health needs and challenges. Concerns about how student data and confidentiality will be handled. Fear of labeling or stigmatizing students. And sometimes students don't currently advocate for services. Some potential resource factors could include insufficient funding for program implementation, no dedicated personnel to do the work, such as counselors, social workers, etc., lack of physical space for private counseling or services, or competing district priorities for limited resources. Some potential environmental factors. A school culture that's resistant to change or innovation, a place where mental health is not prioritized in school improvement plans, historical mistrust between the school and the community, concerns about outside providers interfering in schools, and some potential policy and procedure factors. No district policy supports the integration of services. There's an absence of clear referral and consent procedures. Legal and ethical concerns about provider roles on campus, and lack of board-approved framework for mental health services. As you can see, there are a lot of factors that could be contributing to this problem. The fishbone diagram provides different potential root causes that can be really beneficial for SMART goal creation. It's possible for there to be several root causes that contribute to issues that need to be addressed. And it will be up to the SCG team to determine which root causes are addressed when creating SMART goals. On the previous fishbone analysis slide, we outlined several potential root causes and potential strategies to consider since there are currently not school-based services in the school district, and there are community members expressing concerns. Now let's take a look at what we have uncovered and look at some of the root causes to develop next steps or strategies. This is an essential step in moving into creating a SMART goal. For the sake of this example, we can see that our strategy is to establish a partnership to provide mental health services. That's our goal. You can see that there are several associated root causes that lead to this strategy. This is where the rich discussions can occur for the SCG team. These discussions can lead to the team determining which root causes will be addressed when creating SMART goals. Here are some associated root causes uncovered with the 5 whys and fishbone analysis tools. Mental health stigma, lack of understanding of what school mental health needs and services are, difficult past relationships with outside mental health providers, lack of joint planning with community stakeholders, mental health not prioritized in school improvement plans, and no district policy supporting integration of services. On the next few slides, we'll create a SMART goal for this strategy. Establish a partnership to provide mental health services. Identifying root causes first can aid in creating more thought on intentional SMART goals. As you may recall from the initial diagnostic rubric training last spring, SMART goals are a great tool to use in creating an actionable next step to move toward school improvement. A SMART goal is a framework used to set clear, achievable objectives. We have provided a worksheet for you to use in the development of your SMART goals. SMART goals are goals we develop that are specific, that we can measure how we're doing, achievable and realistic, relevant to our work. And we also want to identify the time frame in which we want to achieve the goal. Let's walk through an example together. In the first part of this training, we walk through the root cause analysis process and 2 strategies to look deeper at potential root causes. Now let's create a SMART goal for this scenario. Over the past summer, communication with the local mental health authority has been initiated about the potential to bring school-based services into the district. There are many community members who have expressed concerns about this partnership. When we consider this scenario and the root causes identified in the first part of this training, there are several different SMART goals that could be created based on what the school team considers to be most important. Let's take a look at the different pieces of the acronym SMART. Here are some specific areas that a SMART goal could be created. Establish a partnership to provide school-based mental health services on at least 2 campuses and educate the school community about mental health in schools. Here are some ways that these specific areas could be measured. Success will be measured by the number of campuses served and community engagement activities completed. Example, 3 listening sessions, 1 FAQ resource, etc. Here are some ways that these specific goals could be achievable based on already initiated conversations and planned community engagement steps. Here are some ways that these specific goals could be relevant. These goals align with the district's mental health priorities and respond to expressed community concerns. And here's one example of a way to make this goal time-bound. Set a deadline for completion by May of 2026 at the end of the school year following implementation. On the previous slide, we shared some different areas that a SMART goal could address. Now let's create a SMART goal based on this process. So taking all the information from the acronym SMART, we could write, by May of 2026, the district will formally establish a partnership with the local mental health authority to provide school-based mental health services in at least 2 campuses. Following a collaborative community engagement process that includes at least 3 listening sessions and creation of a public FAQ resource to address concerns and build trust among stakeholders. Taking a closer look at this SMART goal, each of the areas of SMART, specific, measurable, achievable, relevant, and time-bound, are in bold blue italics font. Let's take a look at another potential SMART goal option for this same scenario. Here's a specific area that a SMART goal could create. Develop and implement a communication and education plan that informs and engages the community. Here are some ways that these specific areas could be measured. Completion of a survey, 2 forums, a published report. Here are some ways that these specific goals could be achievable. Building on existing efforts and focusing on manageable strategic engagement activities. Here are some ways that these specific goals could be relevant. Addresses community concerns and builds trust around school-based mental health partnerships. And here's one example of a way to make this goal time-bound, to set a deadline by December of 2025. On the previous slide, we shared some different areas that a SMART goal could be created. Now let's create a goal based on this process. On the previous slide, we shared some different areas that a SMART goal could create. Now let's create a SMART goal based on this same process. By December 2025, the district will develop and implement a community-informed communication and education plan about potential school-based mental health services in partnership with the local mental health authority, including conducting a stakeholder survey, hosting 2 community forums, and publishing a summary report of findings and next steps to increase transparency and support informed decision-making. Taking a closer look at the SMART goal, each of the areas of SMART, specific, measurable, achievable, relevant, and time-bound, are in bold blue italics font. As you can see, these 2 SMART goal examples consider the root causes of this issue and work towards similar goals with different strategies and timelines. This training has provided an overview of root cause analysis and 2 strategies to use, as well as instructions on how to create SMART goals. Now it's your turn. During the diagnostic process and upon completion of the diagnostic rubric, teams will engage in many rich discussions. It's important that these discussions continue when addressing root causes and creating SMART goals. The SMART goals created by your teams will serve as a roadmap for the school year in support of meeting the needs of the whole child. We look forward to reviewing your SMART goals and supporting you this school year.